Okay, this is the assignment for the substance use disorder. The next slide. Alcohol is an alcoholic drinks or beverages consist of ethanol, which is a psychoactive and toxic compound capable of leading to dependence. And the consumption of alcohol has been identified as a causal factor in over 200 diseases, injuries, and various health conditions. And there's no type of alcohol consumption that is entirely without risk. And even minimal levels of alcohol intake come with certain dangers and can lead to harm, according to World Health Organizations. And the history of alcohol abuse in the US is very extensive and intricate, transitioning from a commonly accepted social practice to a significant public health issue. At first, alcohol consumption was prevalent and even deemed necessary for both social and health purposes. However, shifting attitudes and heightened awareness of its adverse effects prompted social reform movements and eventually led to prohibition. And this prohibition was eventually lifted, and alcohol abuse continues to be a major concern with persistent initiatives aimed at tackling its effects of individuals and society. So, and it's very prevalent in our country. In fact, in 2023, 28.9 million individuals, of which 12 years old and above, has known to have alcohol use disorder, according to the National Survey on Drug Use and Health. And it is more prevalent on males than females. In fact, 16.8 million males and 12.1 million females were affected. And those males are more than 12 years and older are 12.1%, and females with 8.3%. And they said that alcohol affects all individuals, but it's more prevalent on ages 8 to 12. And a good number of individuals who met the criteria for AUD do not receive treatment. Now, what is substance abuse disorder? Well, substance abuse disorder, specifically for alcohol, means that the hallmark of substance abuse disorder can be physical, behavioral, and psychological dependence. Behavioral dependence, which the emphasis is substance-seeking activities and related evidence of pathological patterns, while physical dependence is a physiological effects of multiple episodes of substance abuse. And finally, psychological dependence, which is a habituation or continuous or intermittent craving. And alcohol use disorder is a medical condition characterized by impaired ability to stop or control use. And despite of adverse social, occupational, or health consequences. And the other terms for these are the alcoholism, alcohol addiction, or alcohol dependence. AUD is characterized by a combination of behavioral and physical symptoms. And this could be a withdrawal, tolerance, or cravings. Withdrawal symptoms usually develop in 4 to 12 hours after decreasing intake following a prolonged drinking, while tolerance is a diminished sensitivity of the effects of the alcohol to the body following repeated exposure. And cravings is a strong desire to drink and makes it difficult to think of anything else. And according to DSM-5 criteria, alcohol use disorder is that symptoms occur within 12 months. And the symptoms consist of tolerance, withdrawal, craving to use, using more than intended, difficulty stopping or reducing, spending significant time devoted to the substance, and use despite acknowledging health problems. And it has psychosocial sequelae, which meaning using despite social, occupational, or other adverse consequences, neglecting other responsibilities and neglecting other activities because of use, and the risk or dangerous behavior or situation because of use. And according to DSM-5, the criteria should be 2 or more of the above symptoms, and there is a marked impairment or distress. What are the risk factors for AUD? The risk factor for AUD are the following: drinking at an early stage, genetic and family history of alcohol problems, mental health condition, and a history of trauma. In this study, the drinking at early age, research shows that among people ages 20 and older, those who began drinking before age 15 were more likely to report having AUD in the past year as those who waited until age 21 or later to begin drinking. And then the risk of females in this group is higher than of the males. Genetics and family history of alcohol problems. Genetics play a role with hereditability, accounting for approximately 60%. However, like other chronic health conditions, AUD risk is influenced by the interplay between a person's genes and their environment. And studies also show that parents' drinking patterns may also influence the likelihood that a child will one day develop AUD. And finally, mental health conditions and a history of trauma. A wide range of psychiatric conditions, which include depression, PTSD, and ADHD, are comorbidities with AUD and are associated with the increased risk of alcohol use disorder. Also, people with history of childhood trauma are also vulnerable to AUD. Then what are the short-term effects of AUD? It has increased incidence of falls, nausea and vomiting, decreased inhibition, hangover, interpersonal conflict, and alcohol poisoning. The other one too is the long-term effects of AUD. Alcohol use disorder affects every major organ in our body. It has shown to increase cancer like liver, breast, esophageal cancer, and throat cancer. It also increased the risk of stroke. In the muscular system, it can cause peripheral neuropathy. Also can cause pancreatitis. And when it comes to the cardiovascular, it can cause cardiomyopathy. Also can increase risk of myopathy and increase risk of infection. And what are the signs and symptoms of abuse upon assessment? It depends. It could be mild, moderate, or severe. In mild, there is presence of 2 to 3 symptoms. Moderate is the presence of 4 to 5 symptoms. And severe is the presence of 6 or more symptoms. And as I already discussed earlier, in the DSM-5 criteria, these are the signs and symptoms. fail to limit the amount of alcohol for the individual, and then the individual wanting to cut down on how much to drink, or the individual is making an unsuccessful amounts to do so. The alcoholic person also invests a considerable amount of time in drinking, procuring alcohol, or recovering from its use. And there is an intense cravings. Also, the individuals fail to meet significant responsibilities at work or school or home due to recurrent alcohol consumption. In addition, persisting in alcohol consumption despite awareness of its detrimental effects on physical, social, work, or relationship. It also the individual abandoning or diminishing social and professional engagement and habits in favor of alcohol use. Also consuming alcohol in hazardous situations such as while driving or swimming. Developing a tolerance to alcohol, necessitating increased amounts to achieve the desired effect, or experiencing diminished effect from the same quantity. And also symptoms from withdrawal, like nausea, sweating, and tremors, and when abstaining from alcohol or drinking to alleviate these symptoms. Also, alcohol has the potential for overdose or use as a suicide of weapon of choice. In the studies from 1999 through 2014 on different countries, including the United States, it says that intoxication and chronic alcohol use is associated to suicide. And the meta-analysis studies from 1996 to 2014, it says that acute use of alcohol consumption is related to 7 times increased risk of suicide attempt, and showed dose response association between alcohol levels and suicide risk. What are the possible care plan for AUD? We could have the pharmacological and non-pharmacological treatment. Among the pharmacological treatment which are approved by the FDA are the naltrexone, acamprosate, and disulfiram. Acamprosate is it is well tolerated and relatively safe drug that has been available for the treatment of alcohol dependence syndrome since 1989. And the most common side effects consist of anxiety, depression, asthenia, pain, stomach upset, itching, and sweating. This drug is used primarily to achieve and maintain complete abstinence rather than as a means to reduce or prevent relapse in regular alcohol use. Its use as an adjunct to psychosocial intervention may help improve abstinence maintenance outcome in addicted individuals. The second is the naltrexone. Naltrexone has been approved by the FDA since 1994. And the most common observed side effects of these drugs include GI disturbances, joint and muscle pain, anxiety, headache, and sleep disturbances. And then finally, the disulfiram. This is the first FDA-approved drug for the treatment of alcohol dependence syndrome. And the major limitation to taking disulfiram is the patient cooperation. So the greatest efficacy is observed with supervised use. These drugs are non-addictive and can be used alone or in combination with non-pharmacological therapy. The non-pharmacological therapy consists of, can be behavioral therapy, which include CBT and motivational enhancement therapy. These two therapies can This would help the patients or the individual in their coping skills. Another one is we have to educate the patient. We have to inform the patient that AUD is a medical condition that can be treated rather than a reflection of moral weakness. We can also discuss the potential consequences associated with alcohol use, such as its adverse effects on the body and social consequences. We can also educate the patient on the withdrawal symptoms and when to ask for help. And we have to inform the patient about the treatment options and teach the patient coping strategies to effectively manage the stress. In conclusion, many individuals successfully recover from alcohol use disorder. Nevertheless, setbacks are common for those in treatment, and seeking professional help early on can prevent a return to drinking. Both pharmacological and non-pharmacological approaches can be employed to support individuals in achieving a successful recovery. Thank you.